My name is Sarkodie. I'm a professor of clinical microbiology at the College of Health Sciences, the School of Medicine and Dentistry. Okay, I am the chairman of the planning committee of the college's 9th Biennial Scientific Conference. Every other year, the College of Health Sciences hosts this conference where we look at many important issues of health concern in the country. It also affords us the opportunity to also showcase the work our postgraduate students do within the college. This is the 9th in that series, and the theme of the conference is COVID-19, a health challenge for this decade, lessons learned. So over the past 2 years in this country, we have the Ghana Health Service has led the fight against COVID-19 in this country. So a lot of things have happened, and what the college intends doing, we have invited some expert speakers who will discuss with us what the lessons are over the past 2 years that we've learned from this pandemic, the challenges, so that whatever lessons we as a country have learned will be discussed, but also importantly, how to position ourselves for the future. It isn't only learning lessons, but how as a country we will deal with future pandemics. We are going to get people from governments, the Presidential Advisor on Health, Dr. Cynthia, who will be telling us about what the government has done and what plans it intends to put in place for the future. This the fight against the pandemic has also included people in the private health sector. Okay, we know that the Yahoo Medical Center in Accra has played some part into it. So they will share with us what the experiences have been in the past, and also what they think should be put in place so that the private health sector itself also gets well involved in future pandemics.
My name is Dr. Cynthia Amaning Dankwa. I'm a member of the Scientific Committee for the 9th Biennial Conference on the theme COVID-19, a health challenge for the decade, the role of health professionals. As you're all aware, a lot of health professionals, even from the College of Health Sciences, KNUST-TEK, have played diverse roles in the fight against COVID. And this conference gives us an opportunity to brainstorm, to share our experiences about things that were done and what could have been done better to better place us for the future. The keynote speakers for this year's conference have been carefully selected to share their experiences with us. We have Dr. Isian Asare, who is the Presidential Advisor on Health, and to share his experiences with us, what went wrong, what could have been done better. We also have somebody from the private sector. We have Dr. Elikem Tamaklo. We all know that the private sector also played a key role in the fight against COVID. So they'll be here to share their experiences with us. For the public health aspects of COVID-19, we have Dr. John Amwesi, who would tell us how we have played the global politics very well, how we've been able to get vaccines from our donors, and how best we can get more vaccines for the rest of the population. We also have Professor Gordon Awandare from the West African Center for Cell Biology into Infectious Pathogens. They have been using whole genome sequencing to better understand the virus and its variants. So they talk about variants of concern and variants of interest. So they will help us to better understand the virus and how it changes over time. And then last but not the least, we also have other speakers and postgraduate students presenting their research to us, which may not necessarily be in COVID, but it's all part of building capacity for the College of Health Sciences. They will share research they've been doing for their PhD and master's thesis. We would want to invite everybody to come because it promises to be very interesting, and there's a lot to learn to better prepare us for any pandemic that will come in the future. As you're all aware, pandemics come and go, and to better prepare us so that we are not taken unawares.
Professor Mohammed Mutocheluh. I'm the chair of the scientific subcommittee for this year's conference. My expectations, in fact, I expect it to be the best so far, considering the fact that we are in a pandemic, and then our college is at the forefront of the fight against the pandemic. We have generated a lot of data in trying to solve this pandemic, and this is an opportunity for us to showcase this data to the whole world. So the scientific committee, what we did was to review all scientific abstracts sent for the conference. So we had criteria where we selected the most scored per our criteria, and so we're able to select 177 of them out of over 200 for this particular. That met our standard for this particular. So mainly scientific committee, that's what we do. We have to select based on merit best abstracts for this conference. So in fact, I expect it to be very, very, very exciting. We expect people from around the world. So far, we have had over 300 people who have registered and have confirmed that they will attend. So I look forward to a very fruitful meeting.
What we hope the outcome of this conference will be is that we will all know what it is that our roles should be as health professionals, especially in the college, for the future. If there are any similar pandemics in the future, what our roles should be as health professionals.